Welcome to part 3 of the lymphatic system. Now, sometimes the lymphatic system is affected by other things that make it unable to do its job, and usually that can happen in one of three ways. There can be a blockage somewhere in your lymphatic system, there can be an infection, or there can be a cancer, and then we'll go into some detail with a few examples. Now, if a blockage in the system leads to a buildup of that lymph fluid. And an example of that is a disease called lymphedema. And it sometimes can just result from scar tissue, and that scar tissue has built up inside somewhere, and now the lymph vessels are unable to drain the fluid. And sometimes the scar tissue is from a surgery or radiation therapy, I've heard, or by injury that can happen. And that is just if there was something clogging up the lymph vessels. Um, but sometimes there's other ways that the vessels get clogged. In tropical countries, there's this parasite called threadworm, and it can get inside your skin, inside your body, and it likes to hang out inside those lymph vessels, and that can be pretty nasty. And I do have a picture I'm going to show everybody in a second, but I'd like to wait till the end because some people want to skip that part. Um, Treatment for this includes exercise, massage, or tight wrapping to remove the blockage. Now, especially if it's just caused by scar tissue or something clogged in the vessels that's not the parasite. But remember we talked about how the lymph vessels don't have a heart pumping the fluid through. It's your own skeletal muscles that will squeeze and pump the fluids out of your lymph. And if it's just something blocked in there, you can squeeze it through with massage or tight wrapping and stretching and that kind of thing. But if it's caused by the parasite, then they need to take some medicine. People who live in those areas can take it yearly just to prevent it from happening again. And of course, if you do get the parasite, the medicine will kill it. So, ready for the picture? This unfortunate person has a threadworm in the left leg. It's somewhere probably down below here in the foot area, I would guess, because this looks like where it's the worst. But all this is the skin is breaking down, the skin is getting swollen. All of it is caused by the buildup of lymph in here that can't be processed by the lymph nodes. So some treatment will definitely be necessary. Now, another example of lymph disease is when there's an infection that specifically attacks your own immune system. HIV is a virus, human immunodeficiency virus, that actually attacks your T cells and destroys them. And your T cells are your defense. It's just how you defend yourself against any other pathogen. And once you've lost a certain amount of T cells, I don't know the number or the percent, then you are diagnosed with what's called AIDS, acquired immune deficiency syndrome. So someone can have HIV but not yet have AIDS. It all depends on how many T cells you still have. And we'll talk a little bit more about that with the treatment. HIV is spread through direct contact of bodily fluids, either from vein to vein or through sexual contact. Now, vein to vein was usually people who were sharing needles, especially drug addicts, or maybe even people who were just not being very safe with their own needles for medical purposes. There have been a few cases, especially when HIV was first being discovered, of people getting it from blood transfusions in hospitals. So, there's a variety of ways that it can happen, but it can't be spread from person to person like through direct contact like any other virus, or it's not airborne or anything like that. Unfortunately, there's no cure yet for HIV and AIDS, but there's many successful treatments now. back in the 80s or early 90s when someone was diagnosed with HIV and AIDS, they were probably not going to live very long because you would end up getting another infection, pneumonia, the flu, and that would end up being what killed the person because they couldn't fight off that virus. Their organs shut down, or some the fever would get too high. But now, people who have HIV, just the virus, can stop the loss of T cells. There's certain medicines that they take that cause their bodies to make extra T cells to replace the ones that are constantly being destroyed. So I'll make up some numbers. Let's say you're losing 1 million T cells a day to the virus. Well, these medicines that we take, you're making an extra million a day. So it's kind of like you are staying at the right level because of that. So this is an infection that can cause problems with your immune system and your lymphatic system. Then finally, there's certain cancers of the lymphatic system, and lymphoma is an example. We've talked about a little bit before, but we didn't go into much detail about the different types of lymphoma or what exactly it is. So it's when there's a tumor or cancerous growths in your lymph vessels or the lymph nodes, and there's two major types. Hodgkin's lymphoma is a type that will spread from one lymph node to another. So if someone does have a tumor in one of their lymph nodes, then it spreads to the next, to the next, to the next, and it can be obviously very dangerous. Non-Hodgkin's lymphoma is when it's only in one lymph node, or sometimes it's not in any lymph nodes at all, it's just in the lymph vessels themselves. And as in the case with most cancers, the exact cause is still unknown. Doctors are usually hesitant to say that certain things or certain cancers were definitely caused by other activities. But we do have studies to prove that certain chemicals and certain pollutants can cause lymphoma. But then again, some people just are not exposed to those things and they still get diagnosed with it. And so it's safe to say right now, like unknown is the cause of lymphoma. Um, Treatment can depend on the stage, of course, and we've talked about that with other types of cancer. It just depends on when it is caught, but sometimes chemotherapy works, radiation works. There's some new replacement therapies where they give you antibodies, and those antibodies attach, or yeah, the antigens attach to the cancer cells, and your own white blood cells destroy the cancer cells for you. So a lot of good treatment if it's caught early enough. And that's it for lymphatic diseases.